Hello everyone and welcome back to MediInsights. Today, we're exploring Vecuronium Injection, a critical neuromuscular blocker used in anesthesia to ensure safe intubation and surgical conditions. In this video, you'll learn about its uses, dosing strategies, mechanism, potential side effects, and essential advice to enhance patient safety. Stay engaged with us. Starting with use of Vecuronium Injection. Vecuronium is a non-depolarizing neuromuscular blocker used primarily to facilitate endotracheal intubation and provide skeletal muscle relaxation during surgery under general anesthesia. You might also see it used in intensive care settings when prolonged mechanical ventilation is needed, but that requires careful monitoring. By blocking transmission at the neuromuscular junction, Vecuronium helps you and your team achieve optimal operating conditions. Clinically, this enhances procedural safety and surgical precision. Next, dosage of Vecuronium Injection. For most adult patients, an intubating dose is approximately 0.08 to 0.1 milligrams per kilogram administered intravenously, with onset in about 2 to 3 minutes. Maintenance doses are usually around 0.01 to 0.015 milligrams per kilogram every 30 to 45 minutes, though this can vary based on patient response and procedure length. In some settings, a continuous infusion of 1 to 2 micrograms per kilogram per minute may be used for prolonged relaxation. Always calculate weight-based dosing carefully. Remember to adjust dosing for hepatic or renal impairment, since clearance can be delayed. Monitor train of 4 to guide redosing rather than relying solely on time intervals. Next, mechanism of action of Vecuronium Injection. Vecuronium competes with acetylcholine at nicotinic receptors on the motor end plate of skeletal muscle, preventing depolarization and causing flaccid paralysis. It does not cross the blood-brain barrier, so patients remain unconscious under adequate anesthesia. Onset is moderate, and duration typically spans 25 to 40 minutes after a standard dose. This mechanism underlies both its clinical utility and the need for vigilant respiratory support. Next, side effects of Vecuronium Injection. As a neuromuscular blocker, the primary effect is muscle paralysis. If given without controlled ventilation, respiratory arrest ensues. Cardiovascular effects are usually minimal, but bradycardia can occur, especially with repeated doses. Atropine may be needed. Histamine release is minimal compared to other agents, but rare allergic reactions or anaphylaxis remain possible. Other considerations include residual postoperative weakness if reversal or monitoring is inadequate. Always monitor vital signs continuously and be prepared to manage unexpected reactions. Next, important advices for using Vecuronium Injection. Always confirm that airway control and ventilation are established before administering Vecuronium. Use a peripheral nerve stimulator to guide dosing and ensure adequate recovery before extubation. Keep reversal agents like neostigmine with glycopyrrolate readily available in case of prolonged blockade. Adjust doses in patients with hepatic or renal impairment to prevent accumulation. Be cautious in patients with neuromuscular disorders, such as myasthenia gravis, where sensitivity is increased. Monitor train of 4 count until at least 90% recovery. Educate the care team about silent paralysis. Patients cannot breathe or move but may still sense pain or distress if anesthesia is inadequate. Always coordinate closely with anesthesia providers for safe practice. Thank you for watching. If this video helped you understand Vecuronium Injection, subscribe and post questions in comments below. Your engagement creates valuable medical insights. Stay curious, stay informed. See you in the next MediInsights video. Feel free to comment your thoughts anytime.